CBT stands for Cognitive Behavioral Therapy. It is intended to be short-term treatment that can last a few weeks to a few months. The focus is to provide an individual tools to solve current issues. The goals of CBT are specific, measurable, achievable, realistic, and time-limited. The most often used techniques are cognitive restructuring or reframing, guided discovery, exposure therapy, journaling and thought records, activity scheduling and behavior activation, behavioral experiments, relaxation and stress reduction techniques, role-playing, and successive approximation. The technique I have decided to research is exposure therapy. Exposure therapy is a psychological treatment that has been developed to help people confront their fears. Usually, individuals tend to avoid the fear objects, activities, or situations. Avoiding the fear can make the fear develop into something even worse. During this therapy, the psychiatrist will expose the client to whatever they fear in a safe place or environment. These problems can include phobias, panic disorder, social anxiety disorder, OCD, which is obsessive compulsive disorder, PSD, post-traumatic stress disorder, and generalized anxiety disorder. There are several different ways a therapist can help determine which is best for you. First is in vivo exposure, which is directly facing the fear in real life. Secondly, imaginal exposure, imagining the fear and dealing with that through a therapist. Thirdly, virtual reality exposure, which is facing the fear using virtual reality technology. Fourth, interoceptive exposure, which is used by bringing on physical sensations which you would usually see in panic disorders. So like the therapist would have you run so your heart rate accelerates and would teach you how to deal with the fear in that way. These are paced in different ways, included graded exposure, which is constructing exposure fear hierarchy. These are ranked in according to difficulty. They start with small exposure to the fear and progress to harder ones. Flooding, this starts with the most difficult tasks. Systematic desensitization. This is a combination of relaxation exercises to make them as in the client, feel more manageable. It helps in several ways as well. Habituation, over time the fear decreases. Extinction, which weakens the previous learned associations between what is feared. Self-efficacy, not really sure how to pronounce that, which helps the client feel like they are capable of confronting the fear or manage the anxiety around the fear. Emotional processing allows the client to attach new, more realistic beliefs about their fear so they can become more comfortable with the experience. So I believe that exposure therapy is a great way to treat fear. I know personally I have suffered from social anxiety, so if I'm around like a large group of people and like tight quarters, I start to feel very anxious. And I used to want to run away from those situations and just not be there at all, which, kind of made it hard to have a social life. But I started like a few years ago, just started slowly going out more, maybe like, going to dinner with friends or whatever. And then just like slowly building up to like going to a concert, because that used to give me a lot of social anxiety. So I think that fear therapy is a great exposure therapy, is a great way to face fears for people. I know my situation was somewhat mild and I got over it quickly, but I understand that some people can't. So maybe just the therapist understanding that some fears are going to take longer than others, maybe even more than a few months. I know it's a time-limited situation, but I do believe that it could take more than a few months. And then, just follow-up therapy appointments to speak about how you're feeling and if you're still feeling fear and what you can do from there. I think would also be great. So yeah, that's what I learned about exposure therapy.